Deep in the Peruvian Amazon, situated on the banks of the Rio Momon, a tributary that eventually flows into the world's largest river near the city of Iquitos, lies the village community of Centro Fuerte. Accessible only by boat, Centro Fuerte is a typical village for the area. It is home to about 30 families, has a school, a church, and a regional medical facility that provides rudimentary services. The village does have electricity and an occasional internet connection, but the houses do not have running water or any other convenience. For those living along the river, every day is a challenge. People cook over open fire, wash their clothes in the river, and hunt or fish for their food. During the rainy season, the river can rise up to 50 feet, flooding entire neighborhoods in both the city and jungle. Sanitation is severely lacking, so disease, parasites, malnutrition, and tooth decay are inescapable realities of life. This deep in the jungle, there are no doctors. Often, when someone is sick, the only medical care available is in Iquitos, a 4-hour boat ride away. That trip not only costs money, but requires a family to be away from home and work. When a doctor is needed, the family is faced with a dilemma. Do they make the trip to Iquitos? What sacrifice will they have to make in order to get the care that they need? In 2007, the Selva in Action mission was founded with the goal of helping the people of the Rio Momon. The mission is guided by the belief that access to health care is a basic human right and that pursuing medical care should not involve sacrifice. Since its beginning, a group of volunteers from around the world has ventured up the Rio Momon every year to provide medical and dental care to those in need. This past April, I was fortunate to have had the opportunity to participate in the Selva in Action mission. I am not a doctor or a dentist. I am just a photographer. I helped out wherever I could, but basically my job was to document what I saw. And what I saw was simply ordinary people. It doesn't matter where you're from or how much money you have. We're all the same. We're all human. We love, we laugh, we cry, and we play. But I also saw the poverty, and it was profound. Often, when confronted with a problem of this magnitude, it is easy to be overwhelmed. It is hard to imagine how one mission can really make a difference. What kind of impact can one volunteer have? Last year, a boy named Gleon came to the mission complaining of pain in his right eye. His family was worried that he might be going blind. He was referred to a doctor in Iquitos who might be able to help, but he could not. Gleon needed surgery in Lima. Unfortunately, Gleon's family did not have the money for the trip, so they did nothing. Gleon came back to the mission again this year. He was still in pain, but now blind in one eye and slowly going blind in the other. Sandra, who volunteered on the mission as a translator, wanted to help. She accompanied Gleon and his father to the public hospital in Iquitos. After a brief exam, they were told again that nothing could be done in Iquitos. Sandra did not give up. She made an appointment for later that day at a private hospital. This time, they were informed about an upcoming mission that will specialize in eye surgery, and that Gleon was a perfect candidate. He is now at the top of the list for surgery later this year. Finally, Gleon has hope, but it required help. One person, a volunteer, made a difference. Over the course of 5 days, our team saw over 530 patients, many from villages as far away as a 5-hour boat ride. The doctors and dentists treated illnesses, coordinated referrals, distributed medicine, and pulled lots of teeth. Without a doubt, we helped many people. While Selva in Action has accomplished a lot since 2007, there's so much more that can be done. With more money, more volunteers, and more resources, more communities on the Rio Momon could be served, and more follow-up assistance could be provided to those who need medical attention in Iquitos and Lima. But I'm realistic. There is a limit to what can be done. Extreme poverty is incredibly complex, but that does not mean that you shouldn't help, and it does not mean that it is impossible for you to make a difference. On the second day of the mission, I met a man named Santiago. He was bitten on the leg by a poisonous snake 17 years ago. His muscles atrophied, and he suffers from chronic infections. Santiago explained that if he had a pair of boots to wear through the jungle instead of his old shoes, then he might be able to prevent some of his infections. The problem was that rubber boots cost about $7, and his family needed the money more than he needed the boots. At the end of the mission, we boarded the boat to go back to Iquitos. We left my rubber boots for Santiago. Now I know these boots are not a cure for the harsh realities of his everyday life, but they are something he needed, and he was not able to have them before. For Santiago, a simple act made a difference. Over the years, for the many people of the Rio Momon, Selva in action has made a difference. By donating money or volunteering on a mission, you too can make a difference. Please consider offering your support to the Selva in Action mission.